This video is going to demonstrate the proper way to administer a blood transfusion. So we're going to get our blood tubing. This is the type that can be utilized by the pump whenever possible. We do want to use the Alaris pump to infuse our blood. So what I'm going to start by doing is closing off both of these clamps before I connect them to the bags. So we've already scanned in our blood and had a cosigner verify that the blood is correct for the patient. So now that both of these are clamped, we're going to go ahead and spike the blood. And then from there, we're going to take our normal saline and do the same. And keep in mind, both of these are clamped right now. So what we're going to do first, because we want to prime the majority of this with blood, we're going to start by unclamping the saline for just a very brief moment. So we're going to open this up, and then you'll see that it reaches the drip chamber, and as quickly as we can, once it reaches the drip chamber, we're going to reclamp it. At this point now, we can go ahead and unclamp our blood, and as you can see, we're going to prime the remaining portion of the tubing with blood. We do this for two different reasons. One is that since we have to stay with our patient for the first 15 minutes during the transfusion, we want to make sure that we are seeing the patient receiving the blood, because if we primed with saline, we would only see the patient receiving the saline and we would miss a potential blood transaction. So now that we've primed this, we're going to go ahead and insert into here. We would have already gotten a set of baseline vital signs. And then we're going to go here to channel select. We're going to go to guardrail IV fluids. We're going to select that. We're going to scroll down to blood products. So we're going to select blood components. And then we're going to say yes. So you want to initiate the transfusion at a rate of 100. And you're going to run that rate of 100 for 15 minutes. So in order to achieve that, we're going to put a volume to be infused of 25 cc's. And then we're going to hit start. For the purposes of this video, I'm going to go ahead and fast forward in time. So I'm going to simulate this being nearly complete. And then as it comes close to being complete, we're going to go ahead and open up once we've closed the blood. So transfusion complete. We're going to silence this and pause it for a moment. We're going to close the blood, and we are going to prepare to open the normal saline. Now we're going to go over here to channel select, and we are going to would have already typed in our infusion rate for the remaining portion of the blood transfusion. So let's, for example, just say that that was going to be 176. And we'll go over the math involved with that in a moment. And we want to program just enough saline volume to where it's going to rinse the remainder of the blood product from the empty bag and the tubing into the patient. Usually that's going to be about 25 cc's. So that's what we're going to use here. And I'm going to pause for another quick moment here and make sure that I have clamped the blood, opened up the saline, and then we're going to rinse the remaining volume here into the patient so that they receive all of the blood product. Now I'm going to go ahead and turn this off, and we're going to go over the equation that we use to identify what rate that we're going to transfuse the blood after that first 15 minutes. So you check a set of vital signs, you initiate the infusion. For packed red cells, you're going to run it at 100 cc's an hour with volume to be infused of 25 mLs. If you were giving platelets or plasma, you would be able to skip this step and just initiate the transfusion using the volume of the bag divided by the hours that it's ordered to transfuse over. Now, because with packed red cells, we need to do it a little bit differently to observe the patient-pro reaction. We are going to start by running the blood at 100 mLs an hour for the first 15 minutes. And we do this by setting the rate at 100 mLs and then setting the volume to be infused to 25. Once that's complete, we're going to check a second set of vital signs once we've observed that patient for 15 minutes. And then in order to identify the infusion rate for the remaining infusion, we're going to take the total bag volume and we're going to subtract 25 mLs from that. And then we're going to take the ordered infusion time and subtract 15 minutes from that, and then divide the remaining bag volume by the remaining time. So for example, if your ordered transfusion time was 3 hours, we would now be dividing the remaining volume by 2.75. And that will give you your infusion rate. It's important to note that this equation and these steps are most specific to adult populations. So non-adult populations require additional vital sign frequency beyond the first 15 minutes. So for pediatric populations, you're gonna check vital signs hourly during the transfusion, in addition to checking them at baseline and then after the first 15 minutes. For neonates, you're still gonna check at baseline and then after 15 minutes, and then you'll check it after another 15 minutes, and then you'll go to Q30 minutes times 2, and then hourly vital signs until the blood unit is complete. So then our next step is going to be to check the transfusion 20 to 30 minutes prior to its completion time, as you may need to adjust the total volume to be infused. Once the blood bag is empty, at this point you're going to scan your saline, and then we are going to reprogram the volume to be infused with enough volume to flush the remaining blood that is left in the blood tubing into the patient. So usually that's going to be about 25 cc's. So you would run that at the same rate as you ran the majority of the transfusion. And then once the transfusion is complete, you're going to document the infusion completion and the volume infused.